Good morning and good night, good afternoon, everyone. Welcome to the 2021 Lancet Countdown on Health and Climate Change U.S. virtual launch event. My name is Tia Williams, and I am the Director of the Center for Public Health Policy and Center for School Health and Education at the American Public Health Association. It is my pleasure to kick off the event by introducing our opening keynote speaker, the Deputy Administrator for the U.S. Environmental Protection Agency, Janet McCabe.
Hi, everyone. Thank you for inviting me to speak on this exciting day for the Lancet Countdown and for all the experts and organizations who supported your efforts. I want to start by thanking each of you for all your advocacy on climate change. Your work on the U.S. policy brief and your voices are essential to helping all of us make the connection that protecting public health and protecting the environment go hand in hand. Each scientific report that comes out adds to the body of knowledge about the impacts of climate change and is another opportunity to make connections for policymakers and the public about why we should care about addressing this huge threat to humankind. Your focus on drawing the lines between climate change and public health is one of the most critical, and the credibility and influence of your organizations makes your work all the more important. At EPA, we couldn't agree more that we need to implement a comprehensive response to climate change that prioritizes health and equity. It's such an important message to send to the American people, and it's one that President Biden reinforces, and we reinforce at EPA every day. You've probably heard the president talk about how he's employing a whole of government approach to addressing the climate crisis. What that means is that every federal agency is working, and we are working together to infuse climate change and racial equity into all aspects of our work. It's really an unprecedented way to confront the challenges we're facing, and I believe it is what will make us successful. At EPA, we're moving with a sense of urgency because the health of our communities and our economic well-being are at stake. We're taking aggressive action to get the Clean Cars program back on track, to phase down those super pollutants, hydrofluorocarbons, to deliver a strong proposal to reduce methane pollution from the oil and gas sector, and to help our communities prepare for the impacts of climate change. Our efforts will help cut harmful emissions that cause climate change, clean up the air our children breathe, and ensure healthier communities across America. As we work to accelerate progress on climate change, we're also keeping human impacts and environmental justice front of mind. For decades, Black, Latinx, Indigenous, and low-income communities have suffered from disinvestment, inaction, and environmental injustice. These are the same communities who face higher rates of heart and lung disease, whose children are more likely to develop asthma, and who are struggling under the weight of the pandemic. We cannot allow these health disparities to persist. President Biden signed an executive order that pledges to prioritize environmental justice and to advance a systematic approach to racial justice, civil rights, and equal opportunity. At EPA, under Administrator Regan's leadership, we're incorporating environmental justice into every aspect of our work, including our regulatory, permitting, and enforcement activities. Correcting these longstanding health inequities is our responsibility. President Biden has also called for billions of dollars in new funding through his Build Back Better agenda to help support communities across the country as they anticipate, prepare for, adapt to, and recover from climate-related changes in weather and the environment. And just last week, EPA issued its Climate Adaptation Action Plan, which describes the steps the agency will take to address the impacts of climate change on our communities, from fires in the West to widespread drought and the wide path of destruction left by Hurricane Ida from Louisiana all the way to New York. It is crystal clear that our changing climate is having an impact on our lives and our livelihoods. And this is where the work that you've done in your policy brief is so important. It brings to life the challenges we are all facing. It's not just one part of the country, one community, or one family. We are all facing health challenges that are directly related to our changing climate. Thank you again for having me and for the work that you've done. We have an ambitious agenda to fulfill, one that is deeply focused on ensuring the health and well-being of every community in America. Congratulations on the publication of your policy brief. We look forward at EPA to continuing our partnership and our collective efforts.
A huge thank you to Janet for those insightful remarks. I would now like to introduce you to Dr. Marina Romanello, Research Director at the Lancet Countdown, for her welcome remarks. Marina, take it away.
Thank you, Tia, and thank you everyone for being here. It's an absolute honor to be here representing the work of the Lancet Countdown. I'm going to try to share my screen, and please let me know if you can see my slides and put them on. There we go. Are the slides showing? There we go. Awesome. So I'm here to give you a bit of an overview about what the Lancet Countdown is and our latest report, but I know that Dr. Jeremy Hess will dive a bit deeper into it. The Lancet Countdown is, at its very core, a big research collaboration that tries to pull together the lead research scientists and UN institutions from around the world. We are today 43 institutions from leading academic universities, UN agencies, and other research institutes. And you can probably recognize here quite a few that come from the US. We're an enormous research family. We have over 120 global collaborators. We used to meet in the flesh yearly. This is the last meeting that we had previous to COVID. But since the pandemic, we've shifted to an online world. And that has brought us a lot closer, actually. We are now in contact on a daily basis with researchers from around the world, researchers in the US. In particular, we have a huge family there as well. The work of the Lancet Countdown is captured through annual reports. We've been publishing yearly reports in the medical journal, The Lancet, since 2016. But before that, the collaboration that gave birth to the Lancet Countdown published 2 commissions. The first ever commission published by the Lancet that concluded that climate change is the worst health threat of the 21st century. That was in 2009. Just in 2015, 6 years later, the second Commission on Climate Change and Health concluded that climate change is the biggest global health opportunity of the 21st century, because by tackling climate change, we can actually deliver on many actions that are essential for good health. We can deliver better quality of air, reduced air pollution, better diet, more physical activity, better and strengthened health systems. With that commission and highlighting the opportunity of the co-benefits of accelerated action on climate change is that the Lancet Countdown was born. And this year is the 5th year in which we have been publishing our annual iteration of indicators. We have 44 indicators developed by over 90 scientists around the world. And this indicator tracks the world as it's moving from climate change as a threat to health to hopefully an opportunity to improve our health. We have indicators that capture the health impact of climate change, that look at how health systems around the world are adapting to these health threats, that look at mitigation of climate change and what co-benefit that brings for better and improved health and well-being, and also looks at the economic, social, and political context which enabled that transition. In our latest indicator, we have exposed inequities by looking at our indicators from the point of view of the Human Development Index developed by the UN Development Programme. We have also addressed gender inequities, and we have, above everything, given an updated and more rigorous assessment than ever before of the state of climate change and health. The conclusions of this report are quite dire, I should say, and I know that Jeremy will dig a bit deeper into this. But what we're seeing is that this report is really a code red for health. We're seeing that the symptoms of climate change are worsening in every single indicator that we're tracking. And we're seeing a very slow response from the world, not taking advantage of this enormous opportunity. But in the lead up to COP26, when we're recovering from the COVID pandemic and when we have this opportunity of rebuilding our economies, we are now in a pivotal moment where we really need to act. And it gives us an opportunity to really deliver on all the health benefits and the mitigation that we've been trying to call for so many years. In this, it is hugely important the work that our collaborators from around the world do in developing policy briefs to translate our scientific and research findings into policy recommendations that we can give to the hands of policymakers to ensure that they drive change. Obviously, the US policy brief is an enormous achievement and is critically important. The US is the biggest emitter of cumulative greenhouse gas emissions in the world by far. So the role of the US in leading the way here is absolutely crucial. So we welcome the work done for this policy brief, and thank you all so much for being here. And without further ado, I will hand over. Thank you.
Thank you, Marina. At this time, I would like to introduce you to Dr. Jeremy Hess, the Director of the Center for Health and the Global Environment at the University of Washington in Seattle. Dr. Hess is a global report author and senior author of the U.S. Policy Brief. I would also like to introduce you to Dr. Renee Salas, who holds appointments at the Harvard Global Health Institute, Harvard Medical School, and Harvard Sea Change at the T.H. Chan School of Public Health. Dr. Salas is the lead author of the U.S. Policy Brief and is an author on the Global Report. Drs. Hess and Salas, I will turn it to you now to share your remarks on the 2021 Lancet Countdown Global Report and the companion 2021 U.S. Policy Brief.
Thank you, Tia, for the kind introduction, and thank you all for joining us today to mark the launch of the 2021 Lancet Countdown on Health and Climate Change and the accompanying U.S. brief. A year ago, we came together to present the 2020 Lancet Countdown report and the brief, to recognize the key findings and to consider implications for the U.S. From the depths of a pandemic year in which the World Health Organization estimates that at least 3 million people died from COVID, the 2020 report presented a mixed picture. The report noted great progress on health professionals engaging the issue, not only through research and efforts to address the mounting health impacts, but also through championing the health benefits of decarbonizing the global energy system, starting with the health sector itself. The report celebrated the steadily increasing investment in renewable energy sources, but lamented that the carbon intensity of the world's energy supply had remained constant for decades. It's a chemical dependence we can't seem to shake. The 2020 report also highlighted the pandemic, of course, and the need to pursue a recovery strategy that is closely linked with a strenuous effort to reduce greenhouse gas emissions. The report stated that unless the global COVID-19 recovery is aligned with the response to climate change, the world will fail to meet the target laid out in the Paris Agreement, damaging public health in the short and long terms. The 2020 report also outlined, quote, the emerging health profile of the changing climate, and noted the, again I quote, concerning and often accelerating trends for each of the human systems of climate change monitored. With the 2020 report presenting, quote, the most worrying outlook since the Lancet Countdown was established. That was, unfortunately, until this year. We come together now, as we have in years past, to consider progress since our last meeting. Unfortunately, there's precious little good news to report. The authors from 43 academic institutions and United Nations agencies summarize progress, or lack thereof, on 44 indicators, and report that the trends demonstrate a, quote, unabated rise in the health impacts of climate change and the current health consequences of the delayed and inconsistent response of countries around the globe. The 2021 report documents worsening trends in exposure to extreme heat, particularly among elders and infants. During any month of 2019, the report notes that nearly 1/5 of the planet's land surface was in extreme drought. Yield potential is dropping for all staple crops. These impacts are beginning to reverse decades of advances against food and water insecurity globally, and are felt most by the most vulnerable. This is disheartening to read, but more importantly, it's devastating to the people on the front lines, whose lives and livelihoods are directly threatened. The world's health inequities have been a familiar refrain in recent years, as inequity has characterized the response to both COVID and climate change. With regards to COVID, over 60% of people in high-income countries have received at least one dose of COVID-19 vaccine, compared with only 3.5% of people in low-income settings. Public health capacity cleaves along similar lines, just over half of low-income countries reporting implementation of health emergency frameworks, compared to nearly all high-income countries. Along similar lines, only 52% of countries sampled in this year's report having a national adaptation plan for health. We know from our own experience here with COVID-19 and other disasters that readiness and capacity makes all the difference. The ongoing opportunity to leverage the recovery funds from the COVID pandemic to advance a transition to a low carbon economy, which was highlighted in the 2020 Countdown report, is appearing less and less likely. It's good news that we're investing to emerge intact, but we could be doing it much more effectively as a long-term investment in health. In fact, the report states that, quote, the economic recovery from the pandemic is already predicted to lead to an unprecedented 5% increase in greenhouse gas emissions in 2021, and to bring global anthropogenic emissions back to their peak amounts. Such an overshoot would, quote, irreversibly prevent the world from meeting climate commitments and the sustainable development goals, and lock humanity into an increasingly extreme and unpredictable environment. The 2021 Countdown reports that on the current trajectory, climate change will become the defining narrative of human health, and that narrative will be a lament. The 2021 Countdown report refers to its findings as a code red for a healthy future, and depicts a world afflicted by chemical dependence, in which the ravages of the disease are becoming apparent, and the need for rehabilitation is increasingly pressing. Our dependence is on fossil fuels. We stumble, we fall, laid low by heat waves, droughts, fires, and disease outbreaks, but thus far have ignored the advice to take another path. We continue to subsidize our own demise, opting for a shot to steady our nerves, not recognizing renewable energy is cheaper than it's ever been, and the opportunity cost of continued investment in fossil fuels is at an all-time high. The dependence has proven to be most stubborn in places that fossil fuels built, like the United States. Even high-income countries are burdened, as this year's U.S. brief attests. I had firsthand experience with these impacts in our Seattle emergency departments during the unprecedented heat wave this past June. That event, which was virtually impossible without climate change, was the deadliest weather-related disaster our region has ever faced. We lost hundreds of people over 3 days. As a physician on the front lines, witnessing the human toll of these disasters, with each one, I wonder if we've finally hit rock bottom, a point at which we realize the costs of our addiction to fossil fuels are too high and finally turn course. Earlier this year, the latest IPCC report suggests we're inches away from that point, and the terrifying thing to me is the impacts on human lives could be much, much worse. I was incredibly proud of my colleagues who worked from day into night, into day again, as the heat stalked our region's most vulnerable. But it was also a very sad moment, not only because we lost so many, but because it gave us a very clear picture of what the future is likely to hold. As we head into COP26, we have another opportunity to correct our course. I wish the world's leaders courage as they head into this pivotal moment. And I thank you again for your time and your attention and your commitment to protecting and improving people's health. Back to you.
Thank you, Jeremy. When I was early in my training to be an emergency medicine doctor, I vividly remember the first time a patient crashed on me alone. In mid-sentence, he suddenly became unconscious. I froze for a few seconds. I knew the diagnosis and I knew what needed to be done, but I was alone in the room and I knew that I couldn't do it all. And that realization is what paralyzed me with fear for just a few moments. But then I quickly called for help, and the room filled and overflowed with people, all coming with the mission to save this man's life. And we did it together. With climate change on the stretcher, the room is filling at an accelerated pace. And as the room fills, the fear and paralysis that I inevitably sometimes feel about climate change dissolves when I look at those by my side. I know we will tackle climate change through unprecedented collaboration and coordination. The 2021 Lancet Countdown U.S. brief is supported by over 70 institutions, organizations, and centers who work at the intersection of climate change and health, coming at it from different perspectives. but we are all bound together in our common passion that action on climate change is a prescription for improved health and equity, tied into this immense international collaboration. The take-home message of this year's brief is clear. Climate change is, first and foremost, a health crisis unfolding right now in the United States. There is no safe temperature from a health standpoint, and every fraction of a degree matters for health and equity. These impacts can be subtle, like worsening allergies due to higher pollen, or a transient cough from poor air quality from wildfire smoke that has traveled across the country. But the impacts are also significant illness and death, like heat stroke and heat-driven complications of heart conditions, often in those who are the most vulnerable. Decades of racially biased policies have created inequities worsened by climate change. For example, restricted access to resources, poverty, and discriminatory housing policies force certain communities to be concentrated in high-risk wildfire areas or near major sources of harmful pollution, like highways and refineries, placing certain communities of color at increased risk to climate change. Climate change and our interventions to grapple with it harm health unequally and in sometimes surprising ways. Understanding this is essential to ensuring that we respond in a way that best protects and prioritizes health and advances equity. Our report focuses on extreme heat, drought, and wildfires, three closely related health threats that our country has increasingly experienced. But we look at these recent events also to illustrate themes. Extreme heat shows how climate change harms populations differently. Infants are an extremely vulnerable population, and they experience a total of nearly 22 million more days of heat wave exposure in 2020 with respect to baseline. Drought harms health in surprisingly broad ways. Drought compounds heat-related illness, increases risk of infectious diseases, worsens air and water quality, exacerbates mental health issues, and contributes to food insecurity, particularly in rural areas. Wildfires can harm health far from the origin of the event, showing how interconnected we all are in this crisis. In July of 2021, wildfire smoke from California's massive Dixie Fire reached as far east as Maine, contributing to the worst air quality in New York City in 15 years. Wildfire smoke may be up to 10 times more harmful to human health than pollution from other sources, and early evidence suggests it is more harmful to health at greater distances, perhaps due to chemical changes or a lack of recognition of harms far from the flames. We also must use research to predict where future health threats may arise so we can better prepare. The transmission potential of dengue was on average over 50% higher in the past 5 years compared to the baseline in the 1950s, and briefly rose above 1 in 2017, meaning dengue could potentially lead to an outbreak on U.S. soil in the right conditions. While there are many important actions that we need, we spotlight on 3 focus areas for the Lancet Countdown. First, there must be a rapid increase in funding to protect people's health. Urgent investments in research and local solutions are essential to minimize the health impacts of climate change. But we have to use data to guide our actions. Air conditioning saves lives. It's estimated to have prevented approximately 48,000 heat-related deaths in the U.S. in older persons in 2019. But access varies across the U.S. by region, is inequitable, and unreliable. And the electricity used for it contributes to deaths from air pollution and further increases greenhouse gas emissions, a vicious cycle. We must take a multi-pronged approach, implementing solutions that are available today that are equitable, reliable, and sustainable. Second, we must account for the health-related costs of the burning of fossil fuels in decision-making. We can't make the right calculations and understand how action on climate change is good for our bottom line if we don't understand the true costs by updating the social cost of carbon to include health. Lastly, we call for the U.S. to rapidly cut greenhouse gas emissions by 2030 to the 1.5 degrees Celsius pathway. This is especially essential in areas suffering most from fossil fuel-related air pollution, And thus we call for at least 40% of these investments to go towards improving air quality in under-resourced communities. The U.S. contributed 15% of global greenhouse gas emissions from the burning of fossil fuels in 2019, and we must at least commit to our fair share. Bold, ambitious commitments at COP26 will be the greatest prescription for improved health and equity that the world can write. And this report calls on policymakers to write this urgent prescription before it's too late. Health and equity must be our guiding principles in this equitable transition away from fossil fuels, like understanding how factors such as electricity sources and availability of electric vehicle charging stations worsen health disparities. Dr. Elinor Ostrom, who won the Nobel Prize in Economics, said, "There is no reason to believe that bureaucrats and politicians, no matter how well-meaning, are better at solving problems than the people on the spot, who have the strongest incentive to get the solution right." I can think of no stronger incentive than improving health and accelerating health equity. And this is the common mission that binds all of us together who work at the intersection of health. So my greatest hope and inspiration from this year's report comes in the last page. The list of over 80 people who supported this effort, all standing side by side. I remain hopeful that our country and world will answer the calls laid out here and beyond and do what is needed at COP26 and across the United States. But no matter what happens, I know there will be plenty of work for all of us to still do. We can resolve fear and paralysis on climate change by standing side by side and getting to work on our common mission. So join us and let us model how we can galvanize urgent, unprecedented transformation through unprecedented collaboration to implement climate action as the greatest prescription for improved health and equity. Together, let's go. Thank you.
Thank you, Dr. Hess and Dr. Salas. At this time, I would like to share with you an exclusive conversation about climate science and health within the 5th National Climate Assessment, featuring Allison Crimmins, Director of the National Climate Assessment, and Mary Hayden, the Health Chapter Lead for the NCA 5 and a research professor at the University of Colorado's Lyda Hill Institute for Human Resilience.
I'm Allison Crimmins. I guess I started my career more on the climate science side. I began as a paleoceanographer, so I was studying how climate has changed in our past. And when I was studying that work, it became clear very quickly to me, when you study the past, it makes it obvious just how the current changes in climate change are not aligned with what happened in the past, especially the magnitude and the rate of the change that we're seeing now. So that's where I am now as the director of the 5th National Climate Assessment.
My name is Mary Hayden, and I have a rather eclectic background as well. So I started out with an interest in meteorology and a degree in climatology. And then I realized that I actually wanted to make a difference with that as well. So I wanted to see the human impact and got a PhD in health and behavioral sciences. Currently, I'm a research professor at the Lyda Hill Institute for Human Resilience. And I'm honored to have been selected as the chapter lead for the NCA 5 Human Health Chapter.
With climate change and health, we aren't dealing with just numbers on a page or even a perfectly balanced chemistry equation. I think it's different when you're dealing with people. People are messy, and sometimes we exhibit unpredictable behavior, or we have long histories and traumas, or we just have multiple things we care about, our families and our jobs and our communities and our kids' education, that we're all kind of juggling at the same time. So you could map out the perfect solution to climate change, but once you throw people into that mix, it's going to get messy. So that's why you need an evidence-based approach and a really iterative approach so that we can learn along the way and keep improving. And I think it's especially important if we're going to do this together, if we're going to collectively reach for a future that we all want to live in, a better, safer, more equitable future.
We know that there are multiple groups that are currently suffering from disparities, and they're expected to encounter much more severe consequences of climate change, which also continues to have a disproportionate impact on women's health. And so I think that women are more likely to live in poverty. They're more likely to suffer from increased morbidity and mortality from natural disasters and extreme heat events, for example. And I think that because climate change is seen as worsening existing gender-based health disparities, if I had all the money in the world, I think that I would like to see women brought into the picture more. I would work directly with communities, I think, to ensure that the community's priorities are set, that we ensure that they have a voice in what's happening, and that they also are part of the solution.
I'm hopeful that the 5th National Climate Assessment has more art and more figures involved in it. And I think part of the reason we've expanded our chapters to include more social science topics and more authors who are social scientists is hopefully the outcome of that is that people see themselves in the National Climate Assessment. So they don't see climate change as something happening far away to someone else in some far off place. They pick up this report and they see themselves in it, and they see how climate change is already affecting their communities and their families and themselves and the things they love to do. Because I think that's often the first step, and a good reason for indicators as well is that, you know, if you don't see yourself as part of the climate story and don't see how climate change is already affecting you, it's a lot harder to be part of the solution. So I hope that people pick up this report and recognize the things they're already seeing around them with their own eyes, and it inspires them to be part of the solution. What resonated with me was the drought infographic, which I really appreciated. I was a part of some work a few years ago looking at the impacts of drought on dust, and I was shocked by how huge the impacts were on cardiopulmonary illnesses because of just dust. And that figure does a great job of pulling together the kind of many different cascading or compounding impacts of drought, including the mental health impacts of farmers, the vector-borne disease impacts of things like valley fever, all of those different ways that it's not an extreme event like a hurricane that feels as acute. It can be very long running, but have a lot of cascading impacts.
I think that what I'm really inspired by is seeing things happening at a very local level. I live in Colorado, where we've suffered through drought, we've suffered through wildfires, we've suffered through flooding. And I see that even people who were resistant initially to talking about climate change are now coming to the table. We see the ranchers worried about their cattle, worried about their crops. We see people who are worried about even fishing, recreational types of activities. I'm excited to see that people are all coming to the table, coming together to work out solutions to the existing problems we face.
Thank you to Allison and Mary for that insightful discussion. With that, allow me to introduce you to our panel focused on the topic of ensuring health equity in climate adaptation and resilience. Ami Raval is the Policy and Research Director at the Asian Pacific Environmental Network, an environmental justice organization that empowers Asian American immigrant and refugee communities across California through local organizing, voter outreach, and policy advocacy. In her role, she has published several reports that are directly influencing equitable climate policy in California. Dr. Shanita Johnson is an associate professor of surgery, chief of minimally invasive robotic and bariatric surgery, and program director of the general surgery residency program at Morehouse School of Medicine, Department of Surgery, and Grady Memorial Hospital in Atlanta, Georgia. She is also Senior Fellow in Global Health Equity at the Satcher Health Leadership Institute and Fellow in the National Medical Association Climate Change and Health Equity Fellowship. Dr. Gretchen Goldman is the Assistant Director for Environmental Science, Engineering, Policy, and Justice at the White House Office of Science and Technology Policy. She is on leave from the Union of Concerned Scientists, where she was the Research Director for the Center for Science and Democracy. Dr. Pablo Ortiz is a bilingual climate and water scientist at the Union of Concerned Scientists. Pablo works on developing strategies for vulnerable communities to cope and adapt to the current and projected impacts of climate change, particularly related to water. Dr. Crystal Telly Cordova is a principal hydrologist in the Navajo Nation Department of Water Resources Water Management Branch. Her work pre-pandemic focused on protecting and managing water resources in the Navajo Nation. Additionally, since the start of the pandemic, her work has shifted to providing emergency access to safe water for Navajo residents who live in homes with no piped water. And lastly, this panel discussion is being moderated by Dr. Marcia Jimenez, who is an assistant professor of epidemiology at the Boston University School of Public Health. Her research focuses on addressing the influence of geographic contextual factors throughout the life course, including access to green space, on cardiovascular health, cognitive decline, and health disparities. Marcia, please take it away.
Thank you very much, Tia. Hello, everyone. Thank you for joining us. I'm honored to be here today to moderate the panel on ensuring health equity in climate adaptation and resilience. As a co-author of the 2021 Lancet Countdown U.S. brief, I had the pleasure to work and learn from experts in the field on the unequal harms of climate change and how vulnerable populations are at increased risk of health harms from climate change. In the brief, we learned that decades of racially biased policies create inequities and place individuals and communities who are Black, Latino, Alaskan Native, or American Indian, and other people of color at an increased risk of health harms from climate change. Policies also negatively impact the health of low-income and rural communities and make it harder to adapt to the rapidly changing climate. Relatedly, one of the key messages of the brief was that communities across the United States need support to prevent and respond to the health harms of climate change. It is our responsibility as researchers to try to find climate solutions to address these disparities in health risks. And with this, I would like to start with the first question to all panelists, and please remember that you have 2 to 3 minutes to answer. So reflecting on the 2021 Lancet Countdown U.S. brief, what do you think is a critical lesson policymakers should be taking into account to ensure health equity is being advanced in all efforts to further climate adaptation and resilience in the United States?
Thank you, Dr. Jimenez, for this opportunity to participate in this discussion. We are undoubtedly facing dire consequences due to climate change. And while all populations and all nations are experiencing some impact of climate change on health and many other areas of their society, this report clearly elucidates the increased impact on vulnerable populations and a response that is inadequate. These populations include those with low resources, the elderly, the very young, persons of color, and many other disadvantaged and vulnerable populations. In the U.S., we have seen health effects in these communities with increased airborne, foodborne, and other pathogens, increased allergens, the impact on those with low resources by increasing heat and increasing natural disasters. I currently reside in the Southeast, where we have seen increased heat, natural disasters having a profound impact on the health of our region and increasing the burden on our health system. Certainly, my patients have been impacted with increased levels of obesity, allergens, asthma, heart and lung diseases, cancers, and other diseases. So implementing policies to mitigate climate change and thereby affect the health sequela for all communities and ensure equitable improvement is paramount. To do this, though, we must ensure inclusivity. For far too long, we have excluded or pushed aside the most vulnerable communities and their voices. Without everyone at the table, we cannot adequately address all of the issues at hand and make the impact that is really so necessary. It's been my pleasure to work with policymakers and communities regionally and nationally to encourage these necessary changes. And I encourage our policymakers to reach out to and engage these communities in a lasting manner to ensure that enacted policies have the required impact based on the community's needs. So we must continue to invite everyone to the table in an open and inclusive manner.
All right. Well, the piece of the piece, the policy brief that I picked up on that I wanted to highlight here was around thinking about climate change as a threat multiplier. As the brief lays out very clearly, we are seeing more and more evidence of the impacts of not only health impacts broadly in the community, but also the deep inequities that exist in who is experiencing those impacts. And that climate change is affecting more and more parts of more and more geographies, more and more sectors of the economy, and more populations. And so what I think the big takeaway for decision makers here is to really think about how do we address those inequities, because we cannot tackle this climate crisis without while leaving people behind. What we really need to do is advance and address those inequities. And so who is most affected and who is most vulnerable to the effects of climate change. And as you've been hearing today, that's many of the same populations that have been long disproportionately impacted by pollution and other environmental stressors for decades. And so we need to not only address what the current threat of climate change, but how is climate change making worse a lot of those impacts that we're seeing or other kinds of stressors that are affecting people's health and vulnerabilities. And so the Biden-Harris administration is considering tackling the climate change as a top priority. And we're looking at a lot of different elements of this. And a lot of these necessarily do focus on tackling these inequities and addressing all of these new threats as they touch different parts of our economy and our country. And so one way that we've been doing that is thinking about, how does this play out for each federal agency and each area that they focus, because this is not something that can just be handled by one agency, one part of the government. We need everyone to have a seat at the table. We need communities to inform the best strategies for addressing these issues. And we really need to think whole of government when we're looking at this challenge. And so when I look at this policy brief, I think about how do we really think about all those issues in the context of policymaking, and how can we really address the inequities in addition to tackling the overall problem of climate change. And to do that, we really need everyone on board.
Thank you. We have been saying that we are running out of time now, but this report and many others make it evident that many people ran out of time even decades ago. And this report focuses on equitable health risk of climate change, which means that the most vulnerable are being hit sooner and harder. And the critical lesson for policymakers from my perspective is that investments are often not going to the right places. And initiatives target at reducing the equity gap must start by the most disadvantaged first. So future grants, projects all of these initiatives needs to target the most disadvantaged first. And this, of course, is not an easy task because people living in disadvantaged communities often don't speak English, don't have time to engage, don't know that these programs exist, or don't have the expertise, experience, or resources to apply for funding for their households or their communities. So policymakers need to bring more social scientists and community leaders with the task to reach these communities and understand what are their main challenges, because while communities are very similar, they are not the same. And also they need to identify those in most need of help to invest and implement these projects. And policymakers also need to do this fast, because we are talking about our essential but invisible workers. And essential but invisible workers that we saw particularly during the pandemic. And in the case of California, they were harvesting our food even while wildfires and really poor air quality was all around. So we are talking about these invisible workers that are risking their health and their lives for producing the food and packaging the food that we all consume.
Great. As a representative of a grassroots environmental justice organization, I think reviewing the report, one of the key takeaways, I think it just reinforced much of what we know, as folks have already shared, that the impact of climate change does not affect all communities the same, and that the multitude of climate disasters and impacts our communities are experiencing are hurting frontline communities first and worst. And in that sense, when it comes to what policymakers can do to respond with solutions, traditional models of sort of response are proving deeply inadequate for our communities. In many ways, one of the key recommendations around building resilience to me really pushes to bridging climate mitigation and adaptation, that we both have to address the root causes and reduce emissions at the source, but also realize that the effects are already in motion, and we need to protect communities now that are experiencing the impacts and are being burdened not just by climate disasters, but by economic inequality, by health crisis, and other cumulative impacts. And so there's a real need for holistic solutions in that sense that address the multitude of crises and impacts our communities are facing. So not just with the sort of narrow climate lens, whether that be around emissions reductions or carbon sort of addressing carbon emissions, but also building social cohesion and economic and workforce development and public health responses. And so what are the ways policymakers can really think more broadly across sectors to deliver solutions that really meet community needs in this moment across both climate change and broader social, economic, and health impacts?
It's important to understand the climate change impacts for Native American tribes and Alaska Native villages and underrepresented communities in rural America have exacerbated challenges. Therefore, there's not one standard recipe for addressing health equity in these communities. The COVID-19 pandemic and its discordantly harsh impact on Indigenous people, including the blatant reality of a historical lack of access to essential services and healthcare, are now well known. Water haulers and public water systems are vulnerable to climate change impacts like drought, and black swan events like the pandemic coupled with climate change impact increase health risks. There is a crucial need to understand climate change impacts regionally throughout the United States, to proactively plan climate adaptation strategies and resilience in the U.S. It's critical for policymakers to be proactive when creating policy rather than being reactive. And it's important to have understanding that there is literature available when policymakers are creating new policies to address climate change adaptation planning as well as mitigation strategies. And it's important to think of things like engaging early and often in decision-making processes with the populations that are often underrepresented in these processes. And also it's important to consider increasing co-management of natural resources, and rather than considering the paradigm that currently exists, while also providing adequate funding for climate change adaptation. Oftentimes, with changes in administration, this funding can change as well, but also increasing coordination among federal partners so that financial and technical resources are more easily accessible. Recognizing the interconnectedness of systems and consider strategies that are able to achieve multiple objectives by increasing partnerships across jurisdictional boundaries and at different scales, and integrating climate change consideration. This helps the policymakers be able to create sustainable policies that are proactive and not reactive.
Great. Thank you very much, everyone, for your thoughtful answers in this great discussion. Now, Dr. Goldman, if you can please talk about how can the work that you and your colleagues at the White House Office of Science and Technology Policy are doing to advance climate science, empower and inform community-led climate adaptation and resilience building efforts?
Thank you, Dr. Jimenez. I'm really glad you asked this question because as we've been discussing here, we need to make sure that solutions are working for communities. And at the Office of Science and Technology Policy, we're obviously very focused on the science and thinking about what's coming down the road in terms of science and advancements. But we know that the science is not enough. We need to make sure we can apply that to making sure that translates to protecting people from the worst impacts of climate change, to really put science to work for mitigation and adaptation efforts. And so we're doing a lot to think about those kind of challenges and make sure that they are responsive to what communities need, and trying to make sure we really are centering those inequities that we've been discussing. And so one of those things you heard Alison Crimmins earlier talk about the National Climate Assessment and the efforts that are underway there. One part of that is going to be highlighting success stories and storytelling from communities to make sure that we can learn from communities that already have put in place some solutions and some efforts that others could gain from. So I think that is a key component of what we're doing. And we're also looking at other ways of how do we really tackle the climate crisis at the community level. The president's promised to listen to the science and work with agencies to look across programs and policies, from cleaner transportation to working globally to cut emissions, to ensuring that communities are more resilient to the worst impacts of climate change. So that's happening in a lot of different ways. There's a national climate task force that is inclusive of agencies across the government that's doing a lot of work and thinking about this in a different way, and trying to really advance and think about what are sort of new things that we haven't done before at the government level to think about how to advance this issue. And I wanted to highlight one concrete example that I thought was a really good case of the kinds of changes that we should be thinking about and improvements that we could be making in different parts of policy decisions. So FEMA, the federal agency, just did an analysis to look at, what are things they could do right now in the short term to really affect change on the ground in their disaster response efforts. And so they did an assessment and identified several things that they could do quickly and implemented them directly. And so one of those challenges was reaching underserved communities when a disaster strikes. So these are communities that they often have a harder time reaching in the wake of disasters. So this could be people, for example, that might not have the necessary paperwork to prove that they live where they live. So proving occupancy or proving ownership of houses can be a barrier for many in accessing a lot of the services and federal aid that you get in the wake of a disaster. And so they identified several things they could change to lower that hurdle to really make it easier for people to qualify for that assistance from the federal government. And they impacted that. They made changes to whether you could get federal aid for mold remediation in the wake of a disaster, since that's often a big impact on people after flooding events. And previously it wasn't always able to be funded. So now that is, and they've already given out millions of dollars in the wake of recent disasters, such as the recent hurricanes, the Western wildfires, the Tennessee floods. And so all of these changes to their programs are already in place, and they were able to reach way more people at a higher rate than they normally have been in the past. And so that change, that little policy change or seemingly small policy change has already resulted in huge, meaningful impacts for people on the ground, for disaster survivors. And so as we look to the future and we think about the prospect of more and more climate-linked natural disasters, these are the kinds of things that we can be thinking about and really working to improve how we can serve people and how we can improve health across the board for climate-related threats that we know are here or are coming. And so that's one example, but we're working on lots of efforts like that. And I'm really excited to have this conversation and talk about the ways we can link that with community needs.
Great, thank you very much. The following question is for Dr. Tully Cordova. How is climate change exacerbating water access issues in the Navajo Nation and other Native American communities? And what's needed to ensure universal access to safe running water? Please.
Yes, thank you. The Center for Disease Control and Prevention advised to prevent the spread of the germs during the COVID-19 pandemic, you should wash your hands with soap and water for at least 20 seconds. However, when you come from a household that does not have pipe water in the home, this makes it challenging. The pre-existing clean water access gaps and water quality challenges in Native American tribes and in Alaska Native villages are now more significant than in non-pandemic times. In the Navajo Nation, almost 40% of our households lack access to clean water, a huge gap that would not be tolerated in other communities. Domestic water haulers and public water systems, dryland farmers and irrigators, ranchers, wildlife, recreation, and forests are all vulnerable to drought across the Navajo Nation. The Navajo Nation is reliant on groundwater sources. However, continued drought conditions have impacted shallow groundwater levels and water accessibility for humans and animals. Many of the natural lakes and earthen dams are dry. As a result, there is an increased water demand placed on groundwater wells. The Navajo Nation has experienced extensive impacts attributed to both long and short-term drought. This unprecedented time is an opportunity to ensure universal access to safe running water. The 2021 Infrastructure Investment and Jobs Act and the Build Back Better bill can deliver the funding needed to fulfill the nation's responsibility to its first citizens. It is imperative that this financial support be provided, but providing funding itself is not sufficient. The federal government must commit itself to delivering clean water throughout Indian country and must put in place the mechanisms required to ensure this happens. Access to safe and clean water must be made available now, and promises must be kept and access provided to the most basic of human needs, clean water.
Thank you very much. That was fantastic. The following question is for Ms. Ami Rawal. Could you please talk to us about, so the U.S. brief shows that people of color and low-income communities face a disproportionate burden from climate health harms. And as policymakers across the country work on climate adaptation and resilience, how can local knowledge best inform those efforts, in your opinion?
Yeah, thank you for that question. As I mentioned, we at the Asian Pacific Environmental Network are building power and organizing specifically Asian immigrant and refugee communities that are living on the front lines of pollution and of dirty industries. And so I want to reiterate that for environmental justice communities that have been plagued with the burden of our polluting industries for generations, there is nothing really new about cumulative health burdens. The climate crisis is pervasive. And for many communities, it's felt daily, not just during times of disaster. Therefore, we are really pushing for, as folks have raised, community-driven solutions. Through historic disinvestment and deep systemic failures, our communities have had to be incredibly resilient. And now they are organizing for change and innovating local models for crisis response. When disaster strikes, we see time and time again, communities come together, protecting each other and rebuilding together. In some places, neighbors have formed mutual aid networks to share their resources. Schools are providing food to families, and public libraries are turning into cooling and air respite centers. However, without proper investments and resources, there's only so much our overburdened communities can do, especially in the face of converging crises. So I want to uplift one model that really demonstrates what that sort of community-driven social investment in infrastructure looks like. We've been really advocating for community resilience hubs, which are the transformation of trusted buildings like libraries, youth and senior centers, or health clinics, as well as many other community institutions, into facilities that offer space for folks to gather and access services, not only times of crisis, whether it's the pandemic or climate disasters, but on a daily basis for preparedness and recovery and broader community development. Community resilience hubs make possible a wide range of investment simultaneously, whether that be improved insulation to protect people from extreme heat, clean energy installations like solar and storage for backup power during power outages, or air filtration systems and energy efficiency to combat wildfire smoke. And so we have local models that we're actually partnering with in Oakland and in Richmond to demonstrate what this looks like. And we're pushing for resources both at the state and federally to enable these community-led solutions. And fundamentally, these facilities aren't just about the sort of physical infrastructure, but as I've mentioned, the social cohesion, the organizing, the power building, the services, and the programming, all of the sometimes invisible elements that are really the make or break for communities of whether they have protection and support in the face of all that we're experiencing. And so we really are pushing this model as one that can build our community's ongoing resilience during everyday conditions, and fundamentally are really led through a community-led visioning and design process.
Thank you very much. This question is for Dr. Ortiz. Last year, you co-authored a paper with recommendations for how different levels of California government could better prepare for drought and climate change. What are the public health impacts of the climate and water crisis, and what lessons do you think are most important to ensure disadvantaged communities have the resources they need to respond? Oh, I think you're muted, Dr. Ortiz.
Sorry, thank you. Yes, I was saying that public health impacts from the water crisis and droughts are diverse and complex. And these include nutrition-related effects that lead to food insecurity. And this is because droughts decreased crop nutrients and crop yields, rising food prices, and creating shortages in low-income communities. Droughts, of course, are also related to water diseases because lower water availability and warmer conditions facilitate the growing of bacteria like E. coli, also of algae blooms, or increases the concentration of arsenic and other contaminants, for example, in groundwater. Also, airborne and dust diseases like valley fever or cancers and asthma as consequence of dust particles that carries pesticides and other products used in agriculture, and that they fly into nearby communities. Droughts are also related to more vector-borne diseases like dengue. Mental health effects are another big concern that has taken the lives of farmers and farm workers that lose their crops. And just the impacts of not having water is a huge driver for stress and anxiety. Also, droughts are related to other health effects, derived from the way droughts facilitate other climate events like wildfires or the loss of green spaces and impacts to infrastructure. And one of the problems is that documentation of these health effects of droughts is extremely hard and extremely difficult, considering how droughts often don't have like a clear beginning and don't have a clear end. And also because the effects or the impacts tend to accumulate over time and often be attributed to other related events, like wildfires. And the lesson here is that community engagement is vital, as well as listening and learning firsthand from community members. And a big lesson is that multiple inequities need to be addressed at the same time. And for example, before the pandemic, we did a series of interviews and visited disadvantaged communities, and we thought that water was their main environmental concern. So the people that we interviewed were like, well, yes, water is bad, but air quality is really bad. There are no parks. Education opportunities are poor. There is no fast speed internet. There are no street lights. There are no sidewalks. There is ineffective public transportation. The closest grocery store is that one in the gas station. And the lesson learned is that we may as well address the water or an air issue, and still we want to substantially improve the living conditions in disadvantaged communities without fixing the rest of the system.
Thank you very much, Dr. Ortiz. And last but not least, this is a question for Dr. Johnson. Last year, you co-authored an article in the Lancet about how COVID-19 highlights racial inequalities. What are some of the parallels that you see between how the COVID pandemic and climate crisis exacerbate racial inequalities in the United States?
Thank you, Dr. Jimenez. The COVID pandemic and climate change crises have many parallels, and both crises have served to elucidate and exacerbate the racial inequities that we're seeing in the U.S. It has been quite alarming to view these inequities demonstrated quite shockingly during the COVID pandemic, where communities of color had higher rates of morbidity and died at a much higher rate than their counterparts. Unfortunately, we've seen this time and time again in cancer, mental health, and infectious diseases, to name a few. We are now tracking these data within our health equity tracker to then utilize this data for community-based solutions. These inequities occur in part due to systemic and structural racism, biases, inadequate access, and social and political determinants of health. Similarly, these vulnerable populations are again shown to suffer from inequities that the climate crisis has exacerbated. Lack of education, as well as access to care, resources, and unequal social and political determinants of health show similarities with both the COVID and climate crises. So the COVID pandemic served to spotlight the inequities that we had been fighting for many decades. We are aware of poor access to care, lower rates of insured care, poor access to transportation, housing, and adequate nutrition and water sources due to social and political determinants of health. The climate crisis has borne a similar impact on these vulnerable populations and demonstrated the deepening of racial inequalities. Our communities of color have poor access to safe water. They have increased exposure to airborne pathogens and allergens, and are more likely to live in areas affected by natural disasters. They're more likely to live near energy plants, highways, and other unsuitable regions. Still, due to lower income and lower resources, they have greater difficulty with relocation to safer areas. The racial inequities and climate change have a severe impact on the health of these vulnerable communities. And it's really imperative that we continue to work towards our goals of climate change to make an impact for all, and especially for those who are the most vulnerable.
Thank you to all of our panelists and our wonderful moderator for your reflections. I would now like to introduce you to our next group of speakers who will be addressing the need for federal action for climate justice and health equity. Dr. John Bowis is the Interim Director of the new Office of Climate Change and Health Equity within the Office of the Assistant Secretary for Health. A physician and public health professional with over 25 years of experience working on the health implications of climate change, Dr. Bowis has served as an HHS principal to the U.S. Global Change Research Program and co-chair of the Working Group on Climate Change and Human Health for the U.S. Global Change Research Program since he joined the federal government in 2009. Before coming over to the new office, Dr. Bowis served as Senior Advisor for Public Health to the Director of the National Institute of Environmental Health Sciences. Dr. Kyle White is a George Willis Pack Professor of Environment and Sustainability at the University of Michigan, teaching in the Environmental Justice specialization. His research addresses environmental justice, focusing on moral and political issues concerning climate policy and Indigenous peoples, the ethics of cooperative relationships between Indigenous peoples and science organizations, and problems of Indigenous justice in public and academic discussions of food sovereignty, environmental justice, and the Anthropocene. He is an enrolled member of the Citizen Potawatomi Nation. And lastly, this panel discussion is being moderated by Dr. Georges Benjamin, known as one of the nation's most influential physician leaders because he speaks passionately and eloquently about the health issues having the most impact on our nation today. From his firsthand experience as a physician, he knows what happens when preventive care is not available and when the healthy choice is not the easy choice. As the Executive Director of APHA since 2002, he is leading the association's push to make America the healthiest nation in one generation. Dr. B, take it away.
Hi, Tia. Thank you very, very much. And welcome, everyone. You know, you've heard a lot this morning about the impact of climate change on our health. And I personally believe that climate change is the greatest threat to human health we have today. You know, I recognize the role COVID-19 pandemic has played. And of course, that impact has been huge. But climate change will dwarf the COVID-19 pandemic by several magnitudes of scale. In fact, as a Lancet policy brief points out, its impact is enormous right now on our health, and it's occurring today, and is inadequately being addressed. Now, this new report from the Lancet Countdown on Health and Climate Change takes a focused look on the role our delay in addressing climate change plays every day in warming the planet, and its direct physical impact on our health, from wildfires to droughts to air and water quality. And of course, climate change is making us sicker and less safe than ever before. Of course, there is a federal role in addressing this problem. And President Biden actually made a strong commitment to address climate change when he signed what was a comprehensive executive order in January of 2021 that directed the Secretary of Health and Human Services to establish an office on climate change and health equity. So we're here today to discuss the role and impact and the potential impact this new office can play on our national efforts to address climate change. So with that, let me turn to Dr. Bowis and say, John, you know, what are some of the ways this office can work to fulfill the administration's Environmental Justice 40 directive?
Thanks very much, Georges, and thank you to the organizers of the panel for having me on this today. So the Office of Climate Change and Health Equity is organizing its work around three broad priority areas. The first is our mandate to protect the health of Americans in the face of climate change health threats, especially those most vulnerable. we're also working to address, health disparities and the social determinants of health to the extent we can from our office through climate actions that are being done in other sectors for mitigation and resilience. And then the third broad area is to work directly with the health sector on resilience and decarbonization. So in each of these three areas, we see our office aligning closely with the goals of the Justice 40 initiative. Now, there are two specified pilots for HHS in the Justice 40 initiative. One is the NIEHS Worker Training Program. The other is to enhance the LIHEAP program, the Low Income Household Energy Assistance Program, for cooling, for protecting against heat stress. And we are consulting with the LIHEAP program, providing some technical assistance to ensure that they are reaching the communities as much as possible that are bearing the greatest burden and the disproportionate burden of heat stress. But we have a lot of other things that we're going to be doing that I think align with the Justice 40. And the challenge of a small office, within the Beltway is how do we actually partner with and reach and hear from and empower the communities that are most burdened by existing health disparities and by the health risks of climate change. And we're trying to do that through our regional offices, which have a lot of existing infrastructure, which already bring together the different parts of Health and Human Services and other agencies, and already have partnerships with community-based organizations. And we'll be working with them to have two-way communication and have an action agenda, not a listening session, because we've been listening for a long time. We're ready to actually target the actions into the places that need it most. In our work with the healthcare sector, we're mindful of the need to assure that resources that we put into decarbonization of facilities and moving from on-site fossil fuel combustion in health facilities have to prioritize those communities that are already bearing disproportionate air pollution exposures to particulate matter and other forms of air pollution. And then as our office develops, we're going to be creating training opportunities for underrepresented minority scientists and health professionals in accordance with the goals of the J40 initiative as well. So we're not just working on policy and not just working across HHS and the federal government to inform climate change policies with a health equity lens, but we're also looking to invest in people and in activities that will empower and raise the voices of the most burdened communities.
John, thank you. I think we all look forward to working with you on that. Dr. Kyle, how can this office leverage the enormous knowledge base that indigenous communities already have, and then work with those communities to address climate change?
Absolutely. I appreciate the chance to speak to your question, Dr. Benjamin. It's first important to note the different meanings of indigenous knowledge. And one important meaning is that for generations, well before the United States, diverse indigenous peoples, such as my tribal community, Potawatomi people, we had our own rigorous knowledge systems that we used to survive, to flourish. And oftentimes we have stories in our communities about previous historic periods of having to address different forms of climate change that affected seasons, that produced extreme weather events. And our knowledge systems, because they have a different origin than some of the more dominant science traditions, they oftentimes don't disentangle health, culture, and climate change. In fact, in a lot of indigenous cultures, our knowledge traditions spoke about the fact that you couldn't really detach the climate system from the health system. And so many of these traditions endure and persevere even to this day, and many communities rely on their own knowledge systems for preparing for and addressing climate change systems. And so I think that's one of the first steps, is just to acknowledge the history of our knowledge systems and the fact that actually our knowledge systems were interdisciplinary before interdisciplinarity became a thing in many dominant scientific fields. And so oftentimes there aren't going to be terms that cleanly distinguish between something that's climate related and something that's health related, or something that's cultural, or something that's physical. Another important aspect is that our knowledge systems, and this is kind of another step, oftentimes we rely on them for our day-to-day information and our tactics for survival and our methods for flourishing. And so indigenous knowledge systems are oftentimes able to identify the places where people are exposed to risks at the intersection between health and climate change. For example, indigenous knowledge systems oftentimes speak to the ways in which traditional activities or harvesting or other subsistence activities are actually activities that put people in places where they're exposed to different types of climate change related risks. And so appealing to indigenous knowledge systems is enormous for actually being able to discuss the health impacts, the health risks that indigenous people are facing with respect to climate change. Another step is also to understand that in a lot of indigenous knowledge systems, and this goes more broadly to the issue of working directly with tribes, climate change is traumatic for many of our communities. We watched a lot of our lands be completely dispossessed from us, went through assimilative schools, had multiple environmental burdens and assimilative practices imposed on us, and now we have climate change. But this is not the first time we faced human-caused climate change. We also faced it when the fossil fuel sector removed us from our lands and our territories or shrunk them exponentially to make way for those industries that we now know are responsible for the increase in greenhouse gases in the atmosphere. And so I think it's important for agencies, especially those related to health, to really work with indigenous knowledge systems and all facets of those knowledge systems, including the fact that we know a lot about how to succeed legally and politically and socially. We have a tremendous knowledge of just how our communities work and the adaptive strategies over many generations that we've taken to be able to maintain our continuance as people, despite the discrimination and hostility that we faced in the past and that we still face today.
Dr. Cal, thank you very much. So we really need to take a much more holistic approach to this. This is what I would take away. Thank you. So the brief really focused a lot on heat because the brief wanted to make it real to people. And of course, increased heat exposure is one of the most critical problems that we're seeing with climate change in many of our communities. As someone said the other day, kind of the heat dome within the heat dome. And these increased exposures are due to things like redlining and other policy decisions that were made that created communities that are not being well supported. The brief also talks about air conditioning as an example of life-saving adaptation that, of course, is available during extreme heat events, but also recognizes that adaptation may not be available for everybody. Cost of doing it, including the cost of electricity, the energy costs involved in that can be a real challenge. So let me ask each of you what some ways that this new federal office, and in fact, any of the other federal agencies can do to help work to address this. And John, let me start with you.
Great. Thank you very much. Yeah, this is a good example of how we need to solve our problems now and in the future with new thinking and not the thinking that got us into the problems in the first place. So, even as we've discussed, we're working with the LIHEAP program to try to make sure we get the resources to provide cooling, to keep people's electricity on in the face of an extreme heat event in the near term. That we recognize this is essential to save lives here and now, but it's also not the solution for the long term. Expanding this endlessly so that we're just putting a lot of money into air conditioners is not the solution to climate change health threats. And so as part of this, our office is co-chairing a new heat working group that's bringing together federal agencies to coordinate across what they each bring, both for the immediate response, the short-term response to a heat crisis, but also to the longer-term responses like electrification and weatherization of homes and passive cooling, and also urban heat island mitigation or other forms of built environment mitigation to reduce heat exposures. And this is going to help save energy, reduce costs, and ensure that we thrive in the long term. So we're working to enhance preparedness and response in part by expanding the timescale of advisories so that it's not just a heat wave tomorrow, but giving longer term, several week, seasonal or monthly forecasts, working with our interagency National Integrated Heat Health Information Systems, which has been around for a few years. And we're also reaching out to cities, and putting this together now within this working group to explore pilots and other kinds of integrated planning activities that would help to connect the resources and programs that are being developed and expanded to, like the FEMA BRIC program and other programs that are providing resources for improvement in built environments, and to be able to both target them again to the communities that are already bearing the disproportionate burdens of heat stress, as well as the multiple other cumulative stressors. So get them to the right place and, connect them to the places that are experiencing the greatest burden of heat illness, so that we start to reduce the exposures through means other than air conditioning over the long term.
Thank you. Dr. White, same question.
Absolutely. As a member of the White House Environmental Justice Advisory Council and also a frequent contributor and author for the U.S. Global Change Research Program, I've had the chance to work with a lot of agencies on health and climate change issues. And with respect to heightened heat exposure, I think one of the key areas, and I appreciate that the question referenced redlining, one of the key areas is that a lot of people in agencies are not familiar with some of the land use policies and some of the laws and the history of how tribal lands have been divided and demarcated. And this is also related to the history of infrastructure disinvestment in indigenous communities, as well as the barriers to improving infrastructure and doing so in ways that accord with the sustainable values that many enrolled members of tribes hold. And so, for example, Native people experience heightened heat exposure, both in terms of their housing situation, but also in terms of some of the activities that they do as part of their subsistence and cultural activities. And it's important to note that it's not a matter of Native people being in the wrong place at the wrong time, but there's a history of different forms of land dispossession that have limited Native people's access to lands, that have limited the types of infrastructure that are available on tribal lands, as well as have excluded Native people from decision-making about issues related to their health and well-being. And for example, a lot of folks that I work with, obviously with the exception of colleagues in the Bureau of Indian Affairs, aren't familiar with some of the issues of treaty rights or trust land or reservation land or service areas, or the difference between Alaska Native villages and other tribal government designations. And similar to something as complicated as redlining, these different land use policies are at the heart of why Native people are exposed to heightened heat exposure and other climatic risks, and we need to understand and reform them, and agencies have a big role to play in order to lower vulnerability.
Thank you, thank you, thank you. Those are basically insightful comments. So I just want to give a great deal of thanks to our two panelists, both John and Kyle. I appreciate your efforts. And Tia, back to you.
Thank you. Thank you to our panelists and to Dr. B for moderating and for your thoughtful reflections. At this time, I would like to introduce our final speaker, Dr. Beverly Malone. Dr. Malone is the president and CEO of the National League for Nursing. Under Dr. Malone's leadership, the NLN has advanced the science of nursing education by promoting greater collaboration among stakeholders, increasing diversity in nursing and nursing education, and advancing excellence in care for patients. Dr. Malone's distinguished career has mixed policy, education, administration, and clinical practice, including as Federal Deputy Assistant Secretary for Health under President Bill Clinton.
Thank you so much. I'm delighted to be here. If you don't have a healthy planet, you can't have healthy people. And I'm a nurse, and we're into health. Caring is all about a health system, not an illness system. And so there's a lot of concern within nursing and within healthcare about where we are right now with climate, where we are with with the justice system around climate, and how we can do a better job of making sure that our people, the people that we care for, are getting the care that they need. And that care includes an understanding of climate. I think about African American people because I am an African American person. And one of the things that comes to my mind frequently is that it just didn't start today. And I heard a colleague talking about indigenous people and Native Americans, and I'm thinking, yes, and African Americans, 1619, when that ship came over, that's when things actually started. And what happened during that was a continuation of that. And the tentacles of racism have invaded our system in an incredible way. And it's invaded in terms of the food deserts that we have. It's invaded it in terms of even the way that we think about disasters and how and what happens after the disaster leaves. Who gets build back, build better? Where does that happen? And how does it happen in an appropriate way? And I'm hoping that things are off to change in terms of how that goes for the American people, but for African American people and for indigenous people. I'm also thinking about the issue of climate change in terms of healthcare, just on the units, and how we prepare our nurses, our physicians, and our other healthcare providers. And so I have to go back actually to our faculty members, see how they're preparing those providers, how they're preparing the clinicians. And what I can tell you is that if they're not prepared, they cannot prepare others. And frequently nurses, physicians, we teach the way we are taught if we're faculty members. And so those are issues too. And all of these issues come together around bringing together an issue of making sure that climate change is a part of healthcare, a part of how we view it. When I was growing up, just to give you an example, I used to go out with my little red wagon to the railroad station and pick up coal because we had a coal stove in our house. And I was honored as a child to go out and pick up coal and bring it back to the house to keep it warm, not knowing what danger or what the probabilities were in terms of making a difference in the lives of my family and all the people in my community. We know better now, and we have an opportunity to do better. And healthcare has to include climate change in the teaching, in the knowing, in how we research, in how we make things happen. Thank you, Tia.
Well, thank you so much for joining us today. I hope that you are as inspired as I am. And if I didn't have a suit coat on, I'd be rolling up my sleeves so we could just start to dig in on the path ahead that we will do together. The call is clear. Climate change is a health crisis, first and foremost. And it is beyond time for us to implement climate action as a prescription for the improved health and equity that you have seen that we desperately need. So given that this presentation and this gathering is virtual, it can be a little hard to look around and see the overflowing number of people in the room across the country and world ready to catalyze the transformational change that we need. But I assure you, they are there and growing, and this is just the beginning. We tried to help build our collective toolbox this year. In addition to the U.S. brief, which is available online and in PDF versions in both English and Spanish, we also produced a suite of supporting materials, including summaries for the general public and health professionals, regional fact sheets, and a breakdown of the new science and more. These can all be found on our website, www.lancetcountdownus.org. Now, this material is meant to be a living tool that is used by all of you listening and to strengthen and amplify your amazing existing work. Now, this work took a village and far too many people to name individually, but we're going to try and name a few, and there are so many more than what we highlight here. First off, thank you to American Public Health Association, Climate Nexus, and the Harvard Global Health Institute for their in-kind donations and support that have built our foundation. Thank you to the amazing core team who literally poured their hearts and souls into this work. Paige Knappenberger, who is our co-author at Climate Nexus, you are a powerhouse. Thank you for your essential communication expertise and putting together yet another phenomenal U.S. launch. To Carissa Novak at the Harvard Global Health Institute, you stepped in this year for the first time and quickly came up to speed and flawlessly steered our ship. So thank you so much. To Vivian Taylor, also at Climate Nexus, who joined the team this year, thank you for everything. And thank you to Naomi Byler for leading the development of this suite of additional resources that we hope just adds to your toolbox. And of course, it's been an honor and privilege to work with you, Jeremy, on this over the years, and I look forward to all that's ahead. Thank you to our amazing partners at the Lancet Countdown. We are truly united as one across the globe. Thank you to Harvard Sea Change for your communication support on this effort. And thank you to everyone who was listed on that last page of the brief, which is most inspirational to me. And of course, thank you to everyone for your continued support, mentorship, sponsorship, friendship. We are all in this together, and I am so excited to continue to fill the room and take the steps forward that we need. We're going to get there, I have no doubt. I'm going to turn it over to Jeremy. Thank you.
And you're a great example. You're a wonderful colleague and a great friend, and I'm grateful to be walking this path with you. I want to thank our amazing work group. You're the heart and soul of this effort. You help us advance the science and communicate it more effectively, and we're very grateful. The logos seen here are just those of our academic and professional society partners. We have others to thank as well. Thank you to all of our speakers and our panelists for dedicating your precious time and insight, sharing your wisdom, and lending your experience for a phenomenal event. Thanks, lastly, to the health professionals across the country and around the world who are lending the health community's trusted voice to the call for an urgent transition toward a healthier, more equitable future. It's an honor to be in your ranks. Thanks for joining.